Hi, today I am bringing a new topic, headache. Headaches are a very common condition that most people will experience in their lives. And for that matter, there are different types of headache that a person feels. Like say it can be throbbing, it can be a constant headache, it can be sharp, and it can be dull. Then they are usually treated with medication, then stress management, biofeedback management. So first of all, there are certain categories of headache. The first one is the primary headache. Primary headache. Say for example, the cluster headaches, migraine, new daily persistent headaches, then tension headaches. These are few common primary headaches. Primary headaches, by secondary we mean to say that these headaches are as a result of certain problems, certain diseases. So first of all, disease of the blood vessels of the brain, head injury, high blood pressure, infection, medical or medication overdose or overuse, then sinus congestion, then trauma or tumor. So these are some secondary causes of secondary headache. Okay. So there are more than 150 types of documented headache. What are the symptoms and causes? First of all, is headache hereditary? Yes, to some extent, because if you ask for a family history, sometimes you will get, say most of the time you will get some family history of headache in a family tree. Children born to the adults who are having headache has got 4 times the chance of having headache more than ordinary children. Now, there are certain family conditions which can lead to more common headache in the family. Say for example, eating habits like say caffeine, alcohol, fermented foods, chocolate and cheese. Then exposure to allergens. Then second-hand smoke. Say for example, someone is smoking in your home environment. The second-hand smoke is also a cause of headache. So strong odors in the household or perfumes. So all these are in a family setting. You may have these triggers for headache. So what are the causes of headache? How headache occurs? Pain of the headache results from signals interacting among the brain, blood vessels and the surrounding nerves. So during headache, an unknown mechanism activates the specific nerves that affect muscles and blood vessels. These nerves send pain signals to the brain. So that is why there are certain parts of the head are more common in certain types of headaches. Causes of migraines. Migraines as such, they are a result of unstable nerve, that is hypersensitive or unstable nerve status, and these nerve cells overreact to various factors or triggers, and the nerve cells send out impulses to blood vessels and cause chemical changes in the brain that results in this sort of disabling pain. Okay, the triggers that can produce headache. The triggers. First, alcohol use, changes in eating or sleeping patterns, then depression, emotional stress in the family, with friends, work, or alcohol or school, then excessive medication use. So if you are having headache and if you keep on using more headache medications, it can even lead to prolonged headaches, increasing in headaches. Now, eye, neck and the back strain also can cause headache, and a bad posture also can cause headache. Then lighting, noise, then weather change in the weather, all these things can be triggers. So let us look at the different types of headaches and how they feel like. Say for example, the tension headache, which is the most common headache, is the tension headache, and they are the consistent headache but not throbbing. Mild to moderate, and on both sides of the head, that is both sides can be affected, unlike in a migraine, only one side affected, right? And responsive to over-the-counter medications like say analgesics, if you can buy in over-the-counter, these medications can also help these tension headaches. And worse during routine activities such as bending over and walking up the stairs. Now migraines usually cause throbbing headache. They are moderate to severe in pain, causes nausea and vomiting, pounding or throbbing pain, pain that lasts for 4 to 72 hours, that is 4 hours to 3 days. And they are sensitive to light, noise or odors, and the stomach may be upset, and abdominal pain can also occur. Then cluster headache, there is usually sharp, burning or stabbing pain, and it comes in clusters from 1 to 8 clusters in a day, and also lasts for 2 weeks to more than 3 months. 2 weeks to 3 months, it can last for a long time. That is cluster headache. It comes in clusters. There is usually intense burning or stabbing pain, located behind one of your eyes and the region around the eyes without changing sides. It doesn't change sides, right? Now it is throbbing or constant. So it is either throbbing or constant, usually sharp burning and stabbing pain. Next is new daily persistent headaches. They are usually constant and persistent, and onset is sudden. The starting is very sudden and lasts for more than 3 months. And the location is on both sides of the head, and they usually do not respond to medications. So very common secondary headaches, like first one is a sinus headache. So the sinus headaches are usually felt over the face, like facial pain, and they will have a wet taste in the mouth, deep constant pain around your cheekbones or forehead. So these are the signs of having sinus headache. Facial swelling can occur, then feeling of fullness in the ears, fever, pain that gets worse with sudden head movement or straining, and mucus discharge. Mucus discharge can be through the nose, and also it can come out through the mouth. So there should be a discharge, pain in the face, usually in the frontal area and in between the eyes and cheek. So these are the areas of pain. Another one is in the secondary form, medicine overuse headaches. They usually affect up to 5% of the population. They usually are people who keep on taking pain medications very frequently and for a long time. Eventually this practice can lead to increase in the number of headaches, and the sign of these medication overuse headaches are the headaches becoming more frequent and more days with headaches than without. Then pain that is worse in the morning. This pain, the headache in children. The headaches in children are to be always looked with caution. First of all, there are some triggers, which are the certain foods that trigger headaches for the individual. It differs from individual to individual. Then changes in the sleep habits. Then environmental factors like say weather changes and all. Then stress. Also danger signs. And if we have these danger signs, immediate medical attention is necessary. First of all, the sudden new severe headache, number one. Number two, a headache that is associated with neurological symptoms like weakness, then dizziness, sudden loss of balance or falling, numbness or tingling, paralysis, speech difficulties, mental confusion, and seizures. Okay, then personality changes, inappropriate behavior, vision changes like say blurry vision, double vision, or sometimes blind spots in the visual field. Headache with fever, shortness of breath, stiff neck or rash, headache pain that awakens you at night, then headaches with severe nausea and vomiting, headaches that occur after a head injury or accident, and getting a new type of headache after 55 years of age. So diagnosis. The diagnosis of headache, especially in case of the primary headaches, history is very important. So what are the history a doctor likes to take from the person who is suffering from headache? You should know. First of all, a description of your headache, what the headache actually feels like, how often the headaches happen, how long the headaches last each time, how much pain the headaches cause you. You have to rate it from 1 to 10. Then what foods, drinks or events trigger your headaches? Then how much caffeine you drink every day? Then what your stress levels are and what your sleep habits are like. Then if you have any work issues in your headache started, how long you have had the headache, and whether there is a single type of headache or multiple types of headaches. Then how often the headache comes, what causes the headache is earlier like situations, foods, then medications that can cause trigger. Then if physical activity aggravates the pain or not, then what events are associated with the headache. The events I've already told you earlier, like say speech difficulties, paralysis, numbness or tingling, mental confusion, seizures, like that. Then who else in your family has got headache? Then what symptoms if occur between headache? So headache log has to be prepared. So these are the history, detailed history, which you have to write down. Okay. Now examination of the patient. So when the patient comes, you have to examine the temperature, whether the patient is having fever or any infection, signs of infection. Then whether the blood pressure is high or not, whether there is muscle weakness, numbness, tingling, paralysis, whatever. Then excessive fatigue and wanting to sleep all the time has to be asked. Then loss of consciousness, if any. If there is loss of consciousness, it has to be recorded. Then balance problem like falling. Then vision problems, whether blurry vision, double vision or blind spots. Then mental confusion that I've already told, like dizziness, nausea, vomiting, all this to be recorded. So if we suspect it to be a case of secondary headache, then we have to take the help of MRI or CT scan. But here we don't need X-ray to be taken. X-ray doesn't give any important information. Then regarding EEG, electroencephalogram, it is to be taken only when the patient has got fits or passing out during the headache. So headache causing unconsciousness, like that it will be useful, otherwise it is not useful. So during the management and treatment, so first we need to know what are the things we have to use during the management and treatment. First of all, a patient has to prepare a headache log, everything to be written there, and it has to be properly observed, the history to be properly observed. And one thing you need to know is that every headache doesn't need medication all the time. And some headaches, medication even make it worse. The next one is stress management. Stress management is very much important. You may take the help of some psychotherapists, but usually relaxation techniques have to be done. It may say yoga and meditation may be helpful. Then muscle relaxation, deep breathing, all these things are there in yoga, and you can take the help of yoga or meditation. Then biofeedback is a mechanism where some sensors are applied to the body. These are biofeedback sensors, and they monitor the body's response to headache, whether there is breathing rate increase or not, pulse rate, heart rate, temperature, muscle relaxation or tension, then brain activities. All this can be monitored with the biofeedback sensors. They are also very much helpful. And medications, most of the time over-the-counter medications may be helpful, but you have to take a proper history so that these medications are not to be given very regularly. Now, high blood pressure, all these things are to be controlled. Then especially in a migraine, the triptans usually are helpful to remove the headache, and some drugs which are used in high blood pressure, then seizures and depression can also be helpful to prevent migraine. Now, how to prevent headaches? How to prevent headaches? First of all, you should avoid triggers. So what are the triggers? It may be in the scent, it may be foods, it may be sleep, so habits of sleep, sleep lack, or excessive sleep also can cause headache. Then poor posture when you do in work or when you take rest, poor posture also is very important. And as such, what you need to know is how to approach a doctor and when to approach a doctor. So first of all, the danger signs, we have already told you, the danger signs have to be noted if you have to go to a doctor. So the danger signs which I have already given earlier, they have to be seen and they have to be noticed for going to a doctor. And you have to carry a headache log for all the history which are needed by the doctor, I have already mentioned, are to be carried in writing. Okay, and all the medical history, all the medicines that you have been taking, everything has to be carried to a doctor, and any investigation that you have done and any other disease treatment, you should carry. All papers should be in hand. Now lastly, any home remedies. Do you have any home remedies for headache? Yes, there is. First of all, you have applying heat and cold on your head and neck wherever the pain is, and also around the eyes it may have. Then doing stretching exercises and yoga will really help headache. Then massaging your head, neck and the back, massage will be really good. So massaging will be a great relief to the headache. Then resting in dark and quiet room. So the place where the patient is going to stay should be quiet and dark, and sometimes taking a walk in the open and also in the forest area may be helpful. So naturally everything, whatever I have mentioned, are related to maintaining or reducing stress. Okay, so this much for today for headache, and thank you very much for listening, and I hope that you will stay healthy, wealthy and wise. Thank you very much. Bye bye.